Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Shellie Hall, who is Director of Palliative Care at Baptist Health. Welcome.
Thank you, Dr. Fox.
Let's start out simple. What is palliative care?
So palliative care is patient-centered, family-focused care that targets comfort care, quality of life issues, symptom management issues, and patients who are facing life-limiting serious illness. And it's provided by an integrative multidisciplinary team so that we see suffering as total suffering. So whether it be psychological, physical, or spiritual, we want to address all of those issues. So we have a multidisciplinary team to do that.
Now you say team, so give me an idea who's on your team.
So on our palliative care team, we have a physician, we have a nurse practitioner, we also have, well, on my team I have 2.5 nurses, and then I'm a licensed clinical social worker as well, and then we work really closely with the chaplain, so we have board certified chaplains that we work with each day on all of our patients.
And depending on what the need is at the time, you all can meet those needs.
Yes.
Now, could you give me some examples of palliative care?
So for most of our patients, the primary diagnosis, most prevalent diagnosis we see is with cancer patients, but we do see all diagnoses. So we also get a lot of patients who have had complex chronic issues throughout their life. And as they grow older, those issues become more of an issue. So we help in symptom management with those patients, maybe pain, nausea, anxiety, agitation. Those are probably the most prevalent that we deal with from a symptom management standpoint. And then the next reason we get consulted very often is to assist with goals of care, kind of figuring out those complex decisions that people are faced with when they're in the hospital and where we move forward and where we go from there. What are the resources and how can we support that process?
Now, when you say palliative care, I think of quality of care.
Mm-hmm.
Sometimes you don't want to make the treatment worse of the disease, or at some point in your life, the treatment is not all about survival, but it's about comfort.
Most
That's
definitely.
what you deal with.
Most definitely. So, and palliative means to comfort, actually to ease. So our biggest goal is to help people have the best day possible, whatever that is. Have no agenda. We do have hard conversations sometimes depending on what the issue is and what is facing the patient and family. But our goal is to walk alongside that process and help them figure out what's going to support their medical priorities and quality of life issues moving forward.
Well, now, when you talk about hard conversations, that's in regards to treatment, survivability, and what all that means.
It is.
But that also brings up hospice. Now, is there a difference between hospice and palliative care?
Yes. So palliative care can see the entire trajectory of illness. We can be consulted on day one of diagnosis. Maybe you have a young woman who's been diagnosed with breast cancer, and there's a lot of symptom management needs that need to be supported in that, as well as just the psychological, psychosocial, and the spiritual support that goes along with that to help lift that patient up and possibly move through their treatment to live a long life, but also, if that does not go well, to support those complex decisions as to when we decide to move forward or not with certain care.
Now, hospice, though, is generally with a terminal or 6-month illness,
Right.
but palliative care, I mean, you could still be going for cure. Explain that.
Yes. So hospice doctors, Medicare requires that 2 doctors say you have a prognosis of 6 months or less in order to qualify for hospice. Now, does that mean you can live longer in hospice? Yes. But generally that Medicare guideline is 6 months. For palliative care, we can have patients getting chemotherapy, very curative approaches to care, or it can be somewhere in the middle. And to be honest, in the hospital, that's often what we see, more that part of conservative medical management where people literally are weighing, do we want to be aggressive or is that a burden? And that's really what we talk about very often, is what the benefits and burdens of care.
Now, you mentioned hospital, but palliative care occurs probably a lot in the hospital, but can occur as an outpatient also?
Yes, it can. Actually, at Baptist, we have an outpatient clinic in the cancer center. They don't just see cancer patients, they see all diagnoses in that palliative care clinic. And in Lexington area, Bluegrass Care Navigators, who also is the hospice provider, also does a community palliative care program. So they provide palliative care services in home for patients that can't get out and need that extra support, as well as in potentially assisted living facilities, nursing facilities, and that kind of thing.
So we've got hospital care, we've got outpatient care. That brings up the question of insurance. I know you said hospice and Medicare. Is palliative care covered by insurance?
It is. The physician and the nurse practitioner or the physician assistant that is working with palliative care would bill just like any other specialist bills. But the social work, the nursing, the chaplain support in the hospital, that's just extra support because it is the gold standard of palliative care. So we're very lucky at Baptist Health to have a administration and leadership that supports a robust program.
The whole team to take care of everything that the patient needs at the time.
Yes.
Thanks for all the work you do. Thanks for coming in and telling us about it.
Thank you.
We'll be right back.